Did you know that varicose veins affect nearly 25% of adults over the age of 50? This common condition can lead to discomfort, aching, and sometimes even serious complications if left untreated. Today, I want to share with you some insights on how we can improve circulation in our legs and manage the symptoms of varicose veins effectively. Understanding varicose veins and their impact on our health is essential, especially as we age. Varicose veins occur when our veins become enlarged, swollen, and twisted. They are most commonly found in the legs and can develop for various reasons, including genetics, hormonal changes, and prolonged standing or sitting. In my experience, one of the most significant factors contributing to varicose veins is the natural aging process. As we get older, our veins may lose elasticity, which can lead to valves within the veins becoming weak. These valves are crucial because they help blood flow back to the heart. When they fail to function properly, blood can pool in the veins, leading to the characteristic swelling and discoloration of varicose veins. You might be wondering, what can I do to improve my circulation and manage these veins? That's a great question. There are several practical steps you can incorporate into your daily routine, starting with simple lifestyle changes. One effective method I've found is to engage in regular physical activity. Exercise stimulates blood flow and keeps your veins healthy. Walking, swimming, and cycling are excellent options for seniors. Aim for at least 30 minutes of moderate exercise most days of the week. If you're new to exercise or have mobility issues, don't worry. Gentle activities like stretching or chair exercises can also be beneficial. These movements can help improve the circulation in your legs and reduce discomfort. For instance, simple ankle pumps can increase blood flow. While seated, lift your toes while keeping your heels on the ground, then alternate by lifting your heels while keeping your toes down. This exercise can be done easily at home and doesn't require much time. Another critical aspect of managing varicose veins is maintaining a healthy weight. Carrying excess weight can put additional pressure on your veins, making it harder for blood to flow efficiently. If you're concerned about your weight, consider speaking with a nutritionist or healthcare provider. They can help you develop a healthy eating plan that suits your needs. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Foods high in fiber can also be beneficial as they help prevent constipation, which can contribute to vein problems. Hydration plays a vital role in circulation as well. Drinking plenty of water helps maintain blood volume and promotes healthy circulation. Aim to drink at least 8 glasses of water a day, more if you're active or live in a warmer climate. Herbal teas can also be an excellent option for hydration, offering additional health benefits depending on the herbs used. Now, let's discuss elevating your legs. This simple practice can significantly help alleviate the symptoms associated with varicose veins. Whenever you get the chance, try to elevate your legs above the level of your heart. This position allows gravity to assist in venous return and can reduce swelling and discomfort. You can do this by lying on your back and placing your legs on a pillow or the wall. Aim to do this for about 15 to 20 minutes, a few times a day if possible. Compression stockings are another effective tool for managing varicose veins. These specially designed socks or stockings apply pressure to your legs, helping veins and leg muscles work more efficiently. They can improve circulation and reduce swelling and pain. When purchasing compression stockings, it's essential to choose the right size and level of compression, so consulting with a healthcare provider or a specialist can be beneficial. Now, let's address some common misconceptions about varicose veins. Many people believe that varicose veins are merely a cosmetic issue, but they can also indicate underlying health problems. In my experience, it's crucial to take them seriously. Ignoring the signs can lead to complications like blood clots or skin ulcers. If you notice any significant changes in your veins, such as sudden swelling, discoloration, or pain, it's essential to seek medical advice. Some people might also think that varicose veins are purely hereditary, which is partly true. Genetics do play a role. However, lifestyle factors can significantly influence their development. By taking proactive steps to improve circulation and maintain a healthy lifestyle, we can minimize the risk of varicose veins regardless of our family history. Another concern I often hear is about the effectiveness of various home remedies for varicose veins. While some natural remedies may provide temporary relief, it's essential to remember that they may not address the root cause of the problem. For instance, using apple cider vinegar or witch hazel may help with minor discomfort, but won't replace the benefits of proper exercise, diet, and medical treatment if necessary. Always consult with a healthcare provider before trying new remedies, especially if you are taking medications or have other health conditions. As we age, our bodies undergo various changes, and understanding how these changes affect our vascular health is crucial. Hormonal changes, particularly in women during menopause, can influence the development of varicose veins. This is because estrogen can weaken the vein walls, leading to increased risk. Thus, managing hormone levels under the guidance of a healthcare provider can also be an important consideration. In summary, improving circulation and managing varicose veins involves a multifaceted approach. Incorporating regular exercise, maintaining a healthy weight, staying hydrated, elevating your legs, and possibly using compression stockings can make a significant difference. It's about taking care of our bodies and being proactive in our health management. As we continue our discussion in the next half of this video, I will delve deeper into more advanced treatment options and preventive measures for varicose veins. For now, focus on the practical steps I've shared, and remember, every small change can contribute to a healthier, more vibrant life. Now that we have explored how varicose veins form and the initial steps you can take to ease pressure on your leg veins, let us dive deeper into practical actions you can implement right away. What I've learned over decades of working with seniors is that small steps taken consistently can add up to significant relief. I want to share with you a detailed plan that you can follow each day. Begin your day with a simple routine. Before you even get out of bed, spend a few minutes on a gentle leg ritual. Lie flat and slowly draw your toes toward your head and then point them away. Repeat this ankle pump exercise 10 times on each foot. In my experience, this helps kickstart circulation and prepares your veins for the day ahead. Next, rotate each foot at the ankle 5 times one direction, then back the other way. These exercises are subtle, require no special equipment, and can reduce stiffness. Once you've done your ankle and calf pumps, elevate your legs for 5 minutes. Prop them up on a few pillows so your feet rest above the level of your heart. This simple posture shift allows gravity to assist in drawing blood away from congested areas. I've seen patients report less swelling and a lighter feeling in their legs after making this a daily habit. After your morning leg ritual, move on to light cardiovascular activity. A 5-minute walk around your home or garden can make a world of difference. If you have difficulty walking on your own, use a cane or walker for support or ask a friend to accompany you. What I've learned is that consistency is more important than intensity. Even short walks every day help your heart and veins work more efficiently together. Once you are comfortable with the ankle pumps and walking, consider adding a standing calf raise exercise. Stand behind a sturdy chair or kitchen counter, holding on lightly for balance. Slowly raise yourself up onto the balls of your feet, lifting your heels as high as you can. Pause for a moment, then lower your heels all the way down. Aim for 10 repetitions, twice a day. This move directly engages the calf muscle, which functions as a pump for your veins and pushes blood back toward your heart. In my experience, many seniors worry they might not be strong enough to do these exercises. If you find it challenging to do 10 calf raises at once, start with 5 and gradually build up. It is perfectly fine to rest between repetitions. Remember that gradual progress is still progress. Celebrate each milestone, whether that is 5 raises or 10, because that means you are strengthening the very muscles that support your veins. Hydration plays a key role as well. What I've learned is that even mild dehydration can thicken the blood, making it harder for it to flow through narrowed veins. Try to drink a glass of water when you wake up, another with breakfast, and continue sipping water throughout the day. Aim for at least 6 to 8 cups if your doctor has approved that amount. If plain water feels monotonous, add a slice of lemon or cucumber for a bit of flavor. Dietary choices can either support or hinder your vein health. Incorporate more high-fiber foods such as whole grains, legumes, and leafy green vegetables to prevent constipation, which can put added strain on your pelvic veins and worsen varicose veins in your legs. Fresh berries, citrus fruits, and foods rich in vitamin C help strengthen vein walls. What I've observed in my patients is that those who include at least one vitamin C-rich food at each meal often report feeling less heaviness in their legs. Reducing sodium intake helps prevent water retention and swelling. In practical terms, this means seasoning your meals with herbs and spices instead of salt. Experiment with garlic, ginger, turmeric, and rosemary to add flavor without the extra sodium. Over time, your taste buds will adapt, and you may find you enjoy these natural flavors even more than processed salt. Compression stockings are another cornerstone of varicose vein management. If your veins are causing discomfort or swelling, start by wearing a pair of mild compression stockings with about 15 to 20 millimeters of pressure. What I've learned is that properly fitted stockings make a significant difference. Have a healthcare professional measure your legs or use guidance provided by a pharmacy. Put them on first thing in the morning before you get out of bed, while your legs are still empty of excess fluid. Wear them throughout the day, removing them before bed. Some seniors worry that compression stockings are tight and uncomfortable. If you find them challenging, try rolling them halfway down before stepping in, then gently work them up your leg from ankle to knee. Take your time and consider using a rubber glove trick to get a better grip. Over the first couple of weeks, use them for a few hours a day and then gradually extend wear time as your legs adjust. What I've learned is that self-massage can complement the effects of compression. At night, after removing your stockings, apply a light moisturizer or massage oil. Using both hands, gently stroke your legs from ankle to knee in long upward motions. This helps support drainage of fluid toward the heart. Be careful to avoid pressing directly on any areas where you see a bulging vein. Instead, focus on the surrounding muscle and tissue. This practice not only feels soothing, but also encourages circulation. Managing weight is also important for easing vein pressure. If you carry extra pounds, even modest weight loss can relieve stress on your legs. In my experience, realistic goals are key. Losing 1/4 to half a pound per week through balanced nutrition and gentle exercise is achievable and sustainable. Speak with a diet counselor or work with your primary care physician to develop a safe plan. In addition to diet and exercise, consider hydration from the outside in. Cool foot baths with green tea extracts or diluted apple cider vinegar can act as a mild astringent, helping veins constrict gently. Fill a basin with warm water, steep a green tea bag for 10 minutes, allow it to cool, then soak your feet and lower legs for 15 minutes once or twice a week. I've seen this simple ritual help reduce inflammation and bring comfort to tired legs. Throughout all of these adjustments, challenges can arise. You may experience some muscle soreness from new exercises or find compression stockings difficult to don. What I've learned is that patience and consistency help you push through the initial discomfort. Use a daily journal to track how you feel each day. Note your swelling levels and any improvements in pain. Over time, these records will encourage you by showing real progress. If you ever have concerns about pain that worsens, sudden changes in skin color, or any open sores, reach out to your healthcare professional promptly. These can be signs of complications that require immediate attention. In most cases, however, varicose veins respond well to the steps I've described, and you can manage them effectively at home. If you're finding this information helpful, I would love for you to subscribe and ring the notification bell so you never miss my weekly senior health tips. Before we wrap up, let us talk about posture and seating habits. Many of us spend long periods sitting during the day. Crossing your legs or sitting with poor posture can add pressure to your veins. Instead, sit with both feet flat on the floor and your back supported. Every 30 minutes, stand up and take a short stroll, even if it is just around the room. Set a timer if that helps remind you. Occasionally, seniors ask about herbal supplements such as horse chestnut extract or butcher's broom. While some studies suggest they may help reduce leg heaviness and swelling, it is important to speak with your doctor before adding any new supplement, especially if you take blood-thinning medications. I have seen positive responses in some patients, but it must be done under medical guidance. What I've learned over years of practice is that variety and consistency are the secrets. Rotate through your exercises, change up your diet with new recipes high in fiber and vitamin C, alternate between green tea foot soaks and self-massage. This keeps the routine interesting and encourages you to stick with it. If you would like to support my work, please consider clicking the support button below this video and sending a super thank you. One final practical health tip for your everyday life is this: fill a small spray bottle with cool water and mist your legs several times a day when they feel hot or heavy. This small act can bring immediate relief and reminds you to check in with your circulation.